Once you understand the signs of your teen struggling with mental health issues, it becomes easier to help them through it. Psychiatric mental health expert Christina is back with more advice for parents. So we kind of left off on one of the specific youth services that Lokiten Behavioral Health does offer.
We offer 3 different services, and they actually work very well in conjunction with each other. The first one is our intensive outpatient program, or IOP, and that's sort of a step up for folks who need a little bit more support therapeutically. 3 hours, 3 days a week for 8 weeks. It's kind of a good step down for those coming out of the hospital. Then we have our traditional therapy, which is very important. I work alongside many amazing therapists there at Lokiten, and I highly recommend all of them. They are wonderful people. They work hard to help teach kids coping skills, which is extremely necessary to navigate in a healthy manner through life. And then we do our medication management. I also have outstanding colleagues in medication management. Myself and a couple other wonderful people work very hard and in conjunction with the therapist to provide good mental health care to patients by prescribing medications for them.
I've been to the office before, and one of your partners has a sign that's like, "Be happy, I took my pills this morning," or something like that, and I laughed at it. I thought it was incredible.
Yes, and you know what, we joke around about meds. They're very important, but also therapy, very important.
It's like a double, you got to get both of them to get the full effects of it.
Yes, and the best part about Lokiten is we have 2 different locations of the city, and we also, everything we do in person, we also offer online for those who have difficulty with transportation.
Oh, that's nice. So let's talk about how important it is for family to be involved in the treatment.
It's essential, really, for kids. You know, mental health law in Colorado is very interesting. As young as the age of 12, kids are allowed to independently seek out therapy, and at 15, seek out medication management with or without their parents. However, involving the family is really important. For example, always include parents in my meetings, and then I spend time alone with my adolescents as well. But I think it's important to involve the families because they are home and have the most time with their kiddos, and they know them the best. And so it really, you know, like we were talking about a team effort before, this is part of that.
So we also talked 8 hours is mainly what kids spend out at school every single day, 5 days a week. So I have to imagine that schools and community partners and things like that play such a vital role in helping these kids through these mental struggles.
Absolutely. They are essential. They spend a lot of time, like you said, with those kiddos. And so they're going to be potentially the first people to see something. And they are in a really, I love schools and I love working with schools and the personnel at schools when we communicate and work together, which we have done before, had meetings and group meetings. It really helps us partner together to bring the best mental health ability for that child. The other thing that I like about schools is they're in a unique position to be able to teach certain coping skills, and I sort of have a dream that one day maybe we could collaborate with schools and do a program implementing some coping skills from certain therapies like DBT. Teaching kids that at a young age and letting them implement it as they grow is very important.
Yeah, see, 2025, we're putting it in the atmosphere now, Christina. It's going to happen. It's going to happen.
I hope so.
Okay, how soon can somebody of a youth or of a parent be able to see you guys and kind of figure out how to start those next steps in helping the child's mental health?
Oh, pretty much immediately. We have some providers that have immediate openings. Others of us, you know, a couple of days wait. It depends on the type of provider and things like that. But we definitely could take care of people. They could just go to LokitenBH.com, or they could call 719-600-9455 and reach us and be able to get set up for care right away.
What is something you would tell a parent if you're like, hey, I'm not sure about my kid, if they're in a struggle or not? Should they come see you?
Absolutely. I think it's better to check and meet with a professional who deals with mental health day in and day out. We really could pick up on things that maybe the parents can't. You know, when you're with your child, you're not exactly objective. And you know, you love your kids. It's better to be safe than sorry.
Better to be safe than sorry. Well, Christina, thank you so much for being here today, sharing all this good information. If you want to get a full list of the mental health services from Lokiten, make sure you visit that website that you see on your screen right now. Again, thank you so much for being here.
Thank you, Krista.
We'd also like to say a special thanks to Lokiten Behavioral Health for sponsoring this segment.